We're back now live on MSNBC. The House has passed a new stimulus bill to provide $484 billion in coronavirus relief, with overwhelming support from the chamber's lawmakers, including in the approved legislation are funds to start a loan program for small businesses, as well as additional cash for healthcare providers and virus testing. But the latest bill is just a fraction of the trillions that have already been allocated for relief. And as the death toll and fiscal demands grow, Congress has found itself in a cycle of reacting to the consequences of this virus with no clear end game in sight. We are joined now by Democratic Congresswoman Barbara Lee of California. She is a member of the House Appropriations and Budget Committees as well. Congresswoman Lee, we appreciate you being with us on a Saturday night. I want to get your take right now. We've seen a lot of money thrown at this crisis in some ways. The first round of PPP, that money for small businesses, was snapped up so quickly in some cases by businesses that didn't seem so small after all. Give us a sense about where we are right now in this and what you think lies ahead. Is there more to come, and what needs to be done to improve the value of this money getting to the right places?
Sure. Thank you very much for giving me a chance to talk with you. And first, let me just say, I want to thank our essential workers and those on the front lines, because they are doing a phenomenal job to keep us healthy and safe. And we have to, in this next bill, make sure that we fund our state and local governments, because so many of our essential workers work for state and local government. And it is just totally unfair, and it's immoral not to be able to provide the type of job security, their wages, their unemployment compensation, or a rebate or whatever, and their protective equipment, so that they can do their job. And so we have to fund, in this next bill, state and local governments. We also have to fund SNAP. This last bill, we could not get the Republicans to even talk about feeding people. I mean, when you look at the lines of cars and people all over the country lining up for food, food insecurity is real in the wealthiest and most powerful country in the world. So we've got to put more funding into our SNAP program so that we can provide the basic necessities to people. So many people now live below the poverty line. More people are falling into the ranks of the poor. So minimally, we've got to include an expansion of SNAP.
Let me ask you, if I can, about some of the money in this latest round of funding. $75 billion to hospitals, healthcare providers, another $25 billion for testing as it relates to this virus. There's a conversation around the country right now sparked by what's going on in Georgia, Oklahoma, and Alaska, where they are beginning the reopening process. Is $25 billion toward virus testing enough? Do we need more money? Will that satisfy the need for testing to rebuild consumer confidence, to send people back to their places of work and back to their lives?
Absolutely not. $25 billion is really a significant down payment. But we need to have, and we did put into this bill, a national testing plan. But when you look at the fact that African-American and Latino communities and Native American communities and Asian Pacific American communities are disproportionately impacted by this deadly virus, we have to have first the data and the targeting for this testing. And so we have to include resources for rapid response testing on the type of equipment that's necessary. We must provide more funding for tracing, contact tracing, and we have to put more funding in for community-based organizations and faith-based groups to deliver the messages on the healthcare education that is really necessary in terms of the social and physical distancing. And so this is a good first start, but we have got to do more, and we've got to target these resources into where these communities are impacted the most. And as I said, it's African-American and communities of color and low-income communities and poor communities.
Yeah, Congresswoman Lee, if I can ask you quickly, you heard from Senate Majority Leader Mitch McConnell this week saying that state and local governments should consider the option of going bankrupt as opposed to waiting for federal bailouts, referring to them as blue state bailouts. His office did, because most of these states hardest hit right now are states that are mostly Democratic right now. What do you say to Mitch McConnell, who's basically saying those states should go bankrupt, likely your own?
It's outrageous. First of all, this should not be a partisan issue. People are dying in his state also. And so we have to pull together and make sure that we fund state and local governments. You know, Mitch McConnell didn't give a darn about giving corporations and very wealthy people almost $2 trillion in tax cuts. He has no idea with regard to oversight and transparency. We didn't get one Republican vote to vote for the select committee that's going to monitor and make sure that our funds are being spent properly. And so you can't tell me that he's going to try to penalize blue states and require bankruptcies when, in fact, he has supported giving away billions to millionaires and billionaires. And so we've got to do this together. It's got to be in a bipartisan way. State and local governments deserve these resources because it's the employees who are on the front lines who need their job. And they need us to protect them while they're doing their job.
California Congresswoman Barbara Lee. Congresswoman Lee, we very much appreciate your time on a Saturday night. Thank you very much.
Thank you.